Welcome to the first bite on COVID-19 summary for the past month or so. Those numbers that you will see on the left side of the screen represent the total count of cases worldwide and in the U.S. as of April 15th, 11:20 a.m. California time. The numbers have increased, obviously, during the time of the recording, and by the time you're listening to this presentation, the numbers might actually be higher. Everybody is getting fatigued with the media communications about COVID-19. I am personally getting hundreds of communications on a daily basis between emails and messages. So you need to be very careful what to read. There's a lot of false promises out there, and you don't want to get your information from less than a reputable source. And follow the recommendations by your scientific society. This slide, although very simple and known to everyone, I think is one of the most important slides. This is a disease that we have no cure for, no vaccine, no effective drugs so far. So the best thing we can do now is to take care of the prevention aspect of the disease and spread of the virus. We need to stop the spread of the virus, understanding that social distancing, keeping a distance between people, is now the most effective way of stopping the transmission of the virus. Some countries have taken it more seriously than others, and some cities are now on complete lockdown. They're not allowing people to get out of their homes except for certain categories of workers, including healthcare workers, obviously, but with special permissions. And I think hopefully that strategy will help will help stop the spread of the virus. And I'm not sure how it is being done in Egypt, especially in dense areas with a lot of crowds. But this is one thing we can emphasize to people. Keep in mind the droplets can hang in the air for some time. One of the studies said that the virus can hang with the droplet for quite some time in the air. And if someone is coughing and sneezing, then the droplet can actually travel longer distances. We say keep 2 meters between you and the next person. But if someone is coughing and sneezing, please put a mask on their faces and don't allow them to spread the virus in the atmosphere, because that droplet with cough and sneezing can actually travel as far as 10 meters in the air. For healthcare workers, protective gear or the PPE, personal protective equipments, very important, obviously. You do not take care of these patients without proper protection. If you don't protect yourself, you cannot protect your family members and your patients. When I started taking care of these patients at UCSD, we were told to discard all the PPEs once you're out of the room. And the technique was very vigorous. You had to take off your gloves and take off your gowns and then wash and take your goggles, wipe them with alcohol, and then wash them with soap, put it on a surface to dry or dry it with napkins, and then sterilize again. It was a very extensive process. Nowadays, we're running into a shortage of those PPEs, and people are becoming more creative now in terms of preserving the PPEs. One of the things we're starting to do is re-sterilization of the N95 masks. And as you can see, every employee now puts either his name or ID number on the mask. After 5 usages, put it in a brown bag and submit it for decontamination, and it comes back in a white bag. To the left side, you see a picture of myself wearing the PAPR before entering one of these rooms, and on the right-hand side, you see 5 of those patients that we can bring on one single screen and watch all the patients, and this little microphone enables us to communicate with the nurses or the staff inside the room. So rather than having everybody enter the room, we're trying to minimize the traffic to the room. And I'm thinking to myself that if somebody comes up with the remote control that would control the ventilator settings, that would be a great idea. So every time we need to make a change in the vent settings, we're not sending a respiratory therapist in and out, because again, that's one of the ways we preserve our protective gear. Here is just the station outside the rooms, and we have this, they call them now WOW. It used to be called the COW, a computer on wheels, but I guess some farmers got upset, so they changed the the name into a WOW. So now these are the units. They're mobile units. We can take them from one place to the next, and they are fully equipped with communication tools inside the rooms. I could be sitting in my ICU and communicating with patients across town in a different ICU, and that enabled us to take care of more patients that way. Now we come to the end of the first COVID bite. So I'll meet you on the next bite. Take care.